So one thing that I notice quite often is students will have a problem where the syringe is just dripping and dripping and dripping, and they're losing anesthetics. You can see I've got that drip. And basically, one of the first things you can do to control that with a Harpoon syringe is just pull backwards. You can actually take that drip back into the syringe if you really wanted to, but just pulling back on the thumb ring is going to help actually control that drip and stop that. And that should really do the trick with a Harpoon syringe. So with a self-aspirating syringe, if it's dripping away like that, it's a little bit of a different technique than with the Harpoon syringe. So first thing to try is just changing the angle. Rather than having the needle tip pointing downwards, we're going to actually point that more even or even upwards a little bit while we're transporting the syringe around. Obviously once you go in the mouth, you can't necessarily keep it that way. The other thing too is the better you get at holding the syringe and supporting it without using the thumb ring. You can see I've actually got my ring finger on there on the barrel to help stabilize. That may or may not be possible depending on how you're going to fulcrum when you go in, but that can be a useful technique. And then just using the index and middle fingers to have most of the control of the syringe, then you don't really need your thumb in the thumb ring to actually be stabilizing and putting any pressure on until you go to deposit. So that's going to stop your dripping. If I'm dripping away and then I just take the pressure off of that thumb ring, that'll help quite a bit too.